Hey everybody, it's Matt and welcome back to OK Aussie. It is Sunday. What is the date? It is Sunday the 6th of April and it is currently just gone 7 p.m. and I have fears that Dyan has overdone it and has just said that she's feeling a little bit unwell. The indicators for me was that she has just raced to go to the toilet and she's just had some anti-nausea, some Dyan 4 milligrams. So we're just going to put the pulse oximeter on to her. I've already given her some medicinal CBD while she's there on the top, just to see if it will help. Okay, I'm just going to put this on your wrist just to be able to read what's going on. What else are you feeling? Not very cognizant at the moment, so let's get this through and reading. Put some tape onto that. Let's bring up the device. Where's my Bluetooth one? I need it. Bluetooth on. Sweetie, don't fall over. Oxygen sets at 94, heart rate is 71.
This is your Google Notes. Dyan takes CBD.
She just has already, Googs. Well done you. Stop moving for me. You're like a worm. I'm gonna get this bed flat just in case Dyan has any seizures. Now she's already had her 515 medications for night time, which means she's already had a clonazepam. Getting some dystonia in the face already. Tonic seizure at 701, rigidity in both arms. Oxygen stats are 96, heart rate is 63. Alright, sweet. Okay. That's sweet. Now Dyan has done an activity today. We've taken her to the RAF Aviation Museum in Bull Creek. She was there for a short space of time, but it was getting hot, so we actually abandoned the tour halfway through it and got her home straight away. External temperature is 24 degrees, current room temperature is 25.3. Bring that down a little bit. Oxygen stats are at 94%, heart rate's at 62. Okay, so temperature for her is only 37.2. It's high, but not febrile level. Blood pressure 101/58. Heart rate 62, so remember Dyan's baseline 85/60, so So it's a little bit high for her since she's been lying down. Okay, we have emergency meds ready in case we need them. Getting dystonia with the face. I have the alarms up on the pulse oximetry, so if we have thresholds met with oxygen saturations or heart rate, then we can intervene. Oxygen's ready to go if we need to apply. Not going to apply it unless it hits certain thresholds. 96% oxygen saturation, heart rate is at 64. Just cooling the room a little bit just to bring her temperature down a tad. So doing a thing, doing an activity, doing something, unfortunately has its implications, and trying to break up our routine and give Dyan an outing and an activity probably proved to be a little bit tipping of the iceberg for her. We're seeing the segmented dystonia at the moment in the eyes. So the blepharism, which is the eyebrow movement and engagement across the forehead and those muscles around the eye. You're getting a little bit of slight oromandibular with the jaw, and that might actually increase a little bit as we go through as well. So when you've got the two of those separate conditions, you've also got segmented cranial dystonia. You can see the shrugs and the tics as she's going through seizure activity at the moment. Current time is 7:06 p.m. Oxygen stats are at 94, heart rate's at 65. So we're looking out for at this point in time whether she goes into tonic seizures. We'll just maintain airway, make sure she doesn't aspirate, choke. We'll also keep an eye on the fact that she's also very susceptible to cardiac during these events. So if there's any heart spikes, we've got nitrolingual GTN spray. Of course, if she does go into thrashing seizures with tonic-clonic, we're just going to maintain her safety and integrity because of her hypermobility. She has a neck injury, CCI, cranial cervical instability around the neck, so we have to be careful that we don't put her into a recovery position, put strain on the neck. Oxygen stats may reduce during these phases, so that's why we're keeping an eye closely on that. The jaw thrusting and activity that you're seeing at the moment is part of the oromandibular, and this is all the segmented cranial dystonia. Occasionally you'll see at this point in time focalized dystonia of the hands. Not getting that at the moment, nor are we getting any focalized dystonia of the feet. So still centered around the face. Dyan's had a lot on. This whole week has been an exhaustion for her, so it's high predictability to get into seizures, unfortunately. So obviously doing things like an art exhibition, we've got stresses that are around us that we're dealing with the medical community at the moment, and obviously doing even an activity going out, trying to live a normal life will trigger into these things as well. Bowel medications have also been used, so they also change the electrolyte imbalance and make her even more susceptible, unfortunately. She was very sensible. She was able to determine early during her trip out to the museum that she wasn't feeling well, and we were able to race home. Luckily it was an activity which was only 8 minutes away for us, but we were able to get her cool, relaxing, and she's had a good afternoon recovery. Oxygen stats are stable, still at 96%, 56 beats per minute for heart rate. We monitor it on the device here so we can just see any fluctuations, and there's obviously alarms that will trigger with certain thresholds if they reach. Current time is 7:08. You see the lip pursing. There'll be a bit of bruxism going on at the moment, which is the grinding of the teeth component. You still have the blepharism of the eyes. So this is all dystonia. Dystonia is a movement disorder. It's a progressive movement disorder. Comes on the back of 22q11.2, Dyan's genetic chromosomal disorder that she has. Unfortunately, it's progressed from being just focalized dystonia to being generalized, and also with this cranial segmented dystonia. It sometimes can impact into her breathing, with impact around the diaphragm, esophagus as well, so we've got to be careful of both swallowing and breathing. You can see this jaw thrusting action that's occurring at the moment. Oxygen stats are good at 96, heart rate's reduced a little bit at 59. Now she's already had, like I said, her nighttime medications at 5:15. That means she's already had 2 milligrams of clonazepam at that stage, and her third lot of the sodium valproate. So she is on seizure medication. They help to reduce the severity, the intensity, and the frequency. But when the conditions are like this, and particularly with bowel, the absorption and the efficiency of the medications don't work as we ideally would like them to do. Luckily, we now have a medical grade oxygen concentrator that we can engage with Dyan when she hits certain thresholds. We don't deploy the oxygen concentrator unless she hits certain levels. You can have too much oxygen. That's actually also a bad thing. So it's actually why we use the pulse oximetry to make sure that she's kept in safe bounds. Current time is 7:11. For those that are new to the channel, and you can see the seizure activity, seizures are very, very common. This is another tonic-clonic seizure at 7:10. Seizures are very, very common, unfortunately, and you can see here the focalized dystonia and the twisting sensation. You're getting rigidity across the legs and the feet at this point in time. Seizures, 65% of patients with 22q 11.2 deletion syndrome are likely to have some sort of seizure and seizure-like activities. Dyan has a whole range of them, from focal seizures, focal aware, tonic-clonic, myoclonus seizures, and absent seizures. Now, we haven't noted any absent seizures today, but we do have up here the SEMI-3 camera that's always watching and monitoring Dyan 24/7, day and night. It's got night vision and movement sensors. That helps us to keep her safe and alert me to any issues. Also helps me to keep an eye on when she's having things that we may not always notice. Absent seizures, literally 3, 4, 5, 6, 7, 8 second durations, literally like a blank out. You do not know that they've occurred, and it's only because we're using video that we've actually been able to determine that these have been happening very frequently in Dyan's experience. You're okay, sweetie. This will pass. Oxygen stats are great at 97%, heart rate's 57. Dyan is bradycardic, so we do expect that her heart rate to be quite low. Little Max is down there keeping an eye on the oxygen machine, making sure that it's working, whereas Willow's over there keeping an eye on Mum. Well, actually just resting. We're seeing these seizures in the upper torso. At the moment, I'm happy and keeping her safe at this point in time. I'm not putting her into a recovery position. That's specific to Dyan. Like I said, we don't put pressure on the neck. What I'm doing is very busily monitoring her alerts here, just to keep an eye on the stats, and I'm very happy with those at the moment. 96% oxygen, 59 for heart rate. Unfortunately, during seizures, heart rate can spike incredibly high, and then they can also suddenly drop with the orthostatic intolerance. So we've seen heart rate spikes into 180 up to 210. We've seen heart rate drops down to 34, but it's the oxygen that I worry about the most. Now, what is 22q? It is a chromosomal disorder that Dyan has got. Obviously, from birth, she had a late diagnosis of this condition. It affects anywhere up to 180, 185 different clinical symptoms, and Dyan actually had all of those for years, all the individualized diagnoses before she actually was able to get genetic testing and find what the umbrella diagnosis of with 22q happened to be. It's a microdeletion, missing a small chunk in the long arm of the 22nd chromosome. We have 23 pairs of chromosomes. This means she's missing about 3 million DNA building blocks. And that has obviously an effect because it affects all the cells throughout her entire body. Anywhere between 40 to 60 genes are effectively missing, and some of those genes are tied into things such as seizures, specifically movement disorders. They obviously have also been a causation for her to have autism, ADHD, OCD, her Tourette's, and these different seizures. Hey, sweetie. You're doing really, really well. I'm right here with you. I'm keeping an eye on you, and you're safe at the moment. Room temperature is 23.2. It's a little bit too cold, so I'm going to bring that up. You want to get to that Goldilocks temperature for everything, so 24 degrees inside will be ideal. We don't want her ticking and Touretting as well. And sometimes we can get mixed symptoms simultaneously. So we can be having dystonia while also having seizures, which can also then go into Tourette's afterwards. So, hey, it's a really bit of a mixed bag, but we can get all of these things simultaneously. 7:14 p.m. It is Sunday, 6th of April. 24 degrees outside, 24 degrees inside. Oxygen stats are great, 97%, 60 heart rate. We video record, as we have done for a number of years, all her different episodes, so that we've got this information for the clinical team. Dyan is under over 22 different specialists at a centralised major hospital here in Perth. It's okay, bud. I'm right here. You're doing really well. All your key indicators are in a good space for me, which is what I'm happy for. Hey, it's okay. You're doing really well. You feel sick with nausea? Put some more down the trunk so I can give you more. Is your chest feeling okay? Good girl. Dyan's fighting a range of different infections at the moment. Unfortunately, between Klebsiella, which is a hospital grade, very complex, multi-drug resistant UTI. She also has the shingles, which is the herpes zoster reactivation of chickenpox. So not a happy camper. They're actually waiting for her doctor on Monday to send through pathology and other supports around that. Obviously we're below neutropenia, which is another thing. Your autoimmune is compromised with this condition of 22q. You're very susceptible to picking up bugs, germs, very, very easily, and of course that puts a load on your body as well. It means you're more susceptible to having other ailments simultaneously. Dyan's been in a lot of pain. We had given her some tramadol earlier in the evening. That was probably at around about 4:30 to 5 o'clock, and she'd had 7 drops of the tramadol liquid. We are able to have a reduced level of that to suit her body size. Still getting the piercing, bruxism at the moment, oral mandibular activity, and the blepharism in the face, so none of that's changed. Just going to straighten out her leg posture so that we don't actually dislocate or cause an avulsion of the tendons anywhere in her legs and or hips. The TCs, the tonic-clonic seizures, seem to have settled down, and we're just doing the dystonia at the moment. That's okay, I can live with, and if she becomes cognizant I can give her some more muscle relaxants. We're not needing to apply emergency ASM, so I have midazolam ready to go if need be. Dyan is a 50-year-old female, late diagnosis 22q. Like I said, a lot of separate diagnoses. Part of it also includes fatigue, so she has a crippling, complex, chronic long-term fatigue, MECFS, myalgic encephalitis, so inflammation of the brain. The pain after seizures will commonly emanate like this, so you'll get a lot of the hair pulling, and there'll be pains maybe in the temporalis, occipitalis, top of the head as well. So these indications are normal and will hopefully dissipate very shortly. Otherwise we'll also deal with pain relief medications if need be. It's okay, boo. You're doing really, really well. 7:18 p.m. Oxygen stats are low, we're at 91%, and we've just had a drop off. Sweetie. I'm just going to try and get this sorted out for you. Need some pulse dose just to help at the moment. Okay. You can see the jaw jutting, strutting at the moment, pushing out to the right. Oxygen stats have improved. We're now at 97. Heart rate's at 54. Just giving a low dose pulse at the moment with oxygen stats just while we sustain. Keep an eye on that. No rigidity through fingers or hands. Both toes and feet are fine. There's no displacement of the hips and or knees. It's very common to get patellar dislocation, particularly with 22q, and also very common to get hip dislocation, and obviously seizures can cause other dislocations of other joints throughout us, so we keep an eye closely on that. You're doing really well, Bubba. Oxygen stats have improved back to 98%, so we're just holding that sustained at the moment. Pulse rate is at 54 and 53, it's dropping, so just keeping an eye on heart rate levels at this stage. As I said, there was a high predictability and risk assessments leading towards some sort of seizure activity over yesterday or today. It's just what we do. We expect these based on certain criteria being met, whether it's poor sleep, quality sleep, so disturbed, not feeling rested upon waking, increases in pain, and Dyan's got multi sources of pain at the moment. The dystonia is continuing. Next time that we get some re-engagement with her, I'm going to be able to apply some muscle relaxants. But she needs to be able to swallow those, so I need her to be able to be awake for me to be able to apply that extra medication. Tonic-clonic seizures have settled, so that's a good indication at the moment, and I'm hoping that the earlier interventions of the ASMs have actually helped keep those subdued and low at this stage. This jaw thrusting, grinding, all this activity is going to be very sore on her. Transmandibular joint, particularly on the side here, is going to be getting a bit of work because this jaw's thrusting out to the side. She has got subluxations or mild dislocations on both sides of her jaw. The grinding of the teeth can affect the enamel, the caries, so we've got to be careful of that pressure. And of course, it's quite easy to bite tongue or side of the cheek doing those sort of actions. You're not actually aware of them as well. Oxygen stats to remain high, 98%, great. Heart rate's at 54. Going really well, Papa. Current time is 7:23. She's feeling warm still. It's 23.7 degrees inside. Very hot to touch. Once she becomes more cognizant, I'm going to give her some Panadol, try and bring that temperature down. Going higher, not what I'm actually wanting at the moment, 37.4. So that's a heart rate monitor alert. We've got the first of the lower drops. So oxygen, like I said, is remaining in a good place at 97% at the moment. Heart rate alert, that alarm you just heard was because of a drop below 50. Threshold for her heart rate is at 50. So keeping an eye on that. And we've got Max down here. Hey Max, you helping mummy? You're doing really good, big boy. Max is our ragdoll kitten. whereas Willow, our ragdoll cat's just over there. They're very used to, unfortunately, Mum having a lot of complex medical conditions. We don't have any support staff on at this time. This is at 7:23, not a time when we have supports available. We have limited support hours through the NDIS, the National Disability Insurance Scheme. We are actually currently at an escalation with the NDIS for a change of circumstances. It's a request after coming out of hospitalisation last month. Actually, it was in February, so a little bit more. It takes a lot of time, a lot of paperwork, a lot of appointments, a lot of assessments and reports. Hospitalisation, 6 days. They have accelerated Dyan's need to get additional supports that can help me when she's having critical medical crises like these, because there's multiple risks. Aspiration from choking. She can roll, quite commonly in her seizure, she'll roll into her face plant down, and she can suffocate herself. The dystonia can affect her ability to breathe, obviously coming through the esophagus and obviously with the diaphragm muscles as well. You've obviously got heart rate drops, which can have things with angina, POTS, arrhythmias, they're very common. So she's a medical emergency always at hand, and another tonic clonic seizure, 7:25. It's okay. And here we go. It's okay. Sorry, Willow, that's your card, sweetheart. Very common for her to do left rolls with her seizures. That's the typical presentation for her to actually roll. I'd actually thought we've got out of the tonic-clonic seizure in this set, and I thought we're just going to be getting dystonia. But sometimes these things can even surprise me. And I'm used to them because I've been dealing with them for over 10 years. Nice floppy tone, so we haven't got any dystonic contractions coming out of the legs and or arms, so that's a really good thing. Oxygen stats are at 96, 97%. Heart rate still remains low at 52. That was a lovely card that we got from one of our subscribers on the channel. Great appreciation and thank you for that. That's from Willow. I'll place that back up there. Hopefully it won't fall down on top of us all. Get balancing it. So 22q, this genetic and chromosomal condition, is very confusing. Most doctors will not come across patients in their entire clinical career. They don't get taught it at doctor school during their studies, unfortunately. More jaw thrusting with the left side lower mandible at the moment. Both eyes are approximately shut. Right eye is slightly open by about 5 mils. So they don't come across it, they don't see it in clinical practice. The names of it have changed, particularly over the recent years, from DeGeorge, Spritzgen's, velocardiofacial syndrome, many of the other names around that. Once the capabilities of DNA has come in, they've actually realised that all of those groups of separate conditions were all really one and the same condition, and it's that microdeletion or duplication on the 22nd chromosome, causing this whole array. It's one of the most, out of probably about 4,000 different rare conditions, it's probably the most prevalent, but it's probably one of the least known. Go figure, right? And look, there's a limited amount of research, and research also doesn't really go longitudinal. Most research stops at about 30 years of age, so you don't have the long-term longitudinal view of how it affects patients through their life term. We know that unfortunately with the research, many patients can obviously die in vitro in the first year of their life. Those that get through have got lesser symptoms, and it's a continuum. Not everybody has the same amount or the worsening of that. Some might only have certain aspects or elements of their body affected. Doing so well, Bubba. 97 for oxygen, 54 for heart rate, stable at the moment, 729. Unfortunately, cardiac is the main concern, even if you don't have a congenital heart defect, so captures or fallout or any of the other sort of malformations from birth. You can still unfortunately have things come in later on in life, like aortic root dilation changes, things that they can't actually identify and recognize, but most concerns are around cardiac causes of death for those patients. The dystonia is also another separate rare condition, just like Dupuytren's, which is a contracture that she has on her hand. Dyan's got a whole swath of several different types of rare conditions, and that makes it harder. The medical professionals who are very compartmentalized, who don't work cooperatively together and talk with each other. A bit of choking, so aspiration, we're just going to be careful of that. Unfortunately, the medical professionals don't know and talk to each other and work cohesively here in Australia. We don't have a clinic for adults. There's no clinic to support adult patients for 22q in all of Australia. There are 2 children's clinics, one in Queensland and one here in Perth. But as an adult patient, you can't go backwards, you can't go and see a children's clinic. It's the Medicare system. I know, right? Rocket science doesn't really help. So it's difficult. It is really complex. That's probably also why in the US, the US Society for 22q utilizes the elephant as their logo. And you also see a lot of doctors all over the elephant, looking at the trunk, looking at the ears, looking at the tail, looking at the feet, looking at the tongue, looking at the skin, realizing it's a diagnostic odyssey. You can have so many different doctors who are compartmentalized, looking at separate components. A bit of mild dystonia in the left hand at the moment. A bit more flexure in the right hand. So with that diagnostic odyssey, it can take 8 to 10 years to get a diagnosis for those who have not been picked up early in childhood. Coming around potentially 7:31. Hey sweetie. Left eye is predominantly closed, right eye is open about 1 centimetre. Seems to be a bit more aware but not able to respond. Still getting a fixation of the jaw. We'll thrust to the right hand side. Oxygen stats are at 96, heart rate's at 54. Able to clean lips, which is good. Just keep that in there for me, okay? Hey, sweet pea, you're doing really well. So I'm happy that the oxygen stats with oxygen concentration has been able to stabilise. So at the moment we're at 96, flapping between 96 and 97%. You can see that the heart rate is obviously what's reduced down. So it's at that 50 at the moment. So we're keeping an eye on those levels for her. I have on standby both some painkillers to be able to provide and obviously another muscle relaxant to hopefully get on top of and stop all these contractions because they can go on for a long period of time. They can cause bruising, contusions, tears, avulsions, strain, dislocations. They can affect other body organs. You're doing so well. Right here, Bubba. Yeah, sweet pea. Fixation on all 4 fingers at this point in time. The thumb joint, cell joint is not. So we've got a mild contraction, so mild focal dystonia of the right hand. Left hand, not as much tension, but still kerning in of the external fingers. Still getting jaw thrusting on the left hand side, and you can see some blepharism still with the eyebrow. So eyebrow and jaw. Dyan's not around at the moment, so she's going in and out during this phase. Hey, sweetie. Oxygen starts at 97, heart rate's 54. My darling, you're very warm, sweetie. Current room temperature is 24.2. I'm just going to cool that down a little bit further because her body is warm and I can't get medications into her at the moment. I don't want to make her too chilled so that she starts ticking. Oh, beautiful lady. It's alright, this is going to pass. Some of the earlier medications should hopefully be helping to subdue, reduce the tone of what this is doing, affecting the frequency, so reducing the frequency, reducing the severity, which are hopefully really good things, but we do need to get some additional medications into her. Oxygen stats are at 97, heart rate's at 51. Now, Dyan had an absolute ball going to the aviation museum today. It was a bit of an autistic dream for her. It was a fun activity, but like I said, any activity does have its toll. We obviously pace. We have been resting for days, doing no activity, no outings, nothing, literally just bed rest. And obviously that's just trying to manage her energy envelope and also PEM, post-exertional malaise, that comes with it. Understanding that doing something takes its toll and you have to have a recuperation period to recover, and that can take days, sometimes if not weeks. Problem is, we have a lot of things that also get thrown at us from doctor and clinic or hospital appointments that come along, activities of daily living that need to be done as well. It's a bit like the voting. The federal elections are now being obviously announced in Australia, so they'll be coming up, I think, on the 2nd of May. I've already applied for postal votes so that Dyan and myself, as her full-time carer, we can do those from home, post those in, and we don't have to try and attend a busy day where there's a lot of people, which is risk for infection. If it's a hot day, risk of her having more seizures or other attacks because of expecting to be sitting up and waiting in queues, and then being able to collectively prepare herself to actually participate and do the ballots process. So there's a lot of thought processes that have to come into managing a patient who's got chronic conditions, disabilities throughout all of this. Hey, sweetie. Hello, my gorgeous girl. Hello. I'm going to bring you up a little bit so you're a little bit cognizant. Just to there. Left eye is pretty much fully closed. That's part of the blepharism, and that's coming in with the facial dystonia. The right eye is pretty much fully regained. Hey, darling, just relax where you are at the moment. What do you need? Yep, I'm here, sweetie. As soon as you're able to swallow, I need to give you some extra medications, okay? And you have to tell me that you can swallow. But at the moment, you've still got some dystonia going on, so I'm cautious of that. Do I have a little sip of a drink? I'm going to try that. Okay. I'm not going to give you anything to swallow at this stage, just have a little sip of a drink. The lips are here. Just wet your whistle. Did you get some fluid? Go. It's very difficult with dysphagia to try and take fluids on board, and that's why it's very difficult to give oral medications in this phase. Left eye is starting to release, so we're starting to get a little bit of opening coming through at the moment. Very warm. I do need to give you some Panadol as soon as I can to bring the temperature down. I need to give you some muscle relaxant, so you want to try and swallow now? Okay. Okay, I've got 2 tablets that we're going to try and take. You okay to do that? And switch up a bit more. I'll pop them in your mouth myself so that we don't drop them during this phase. Okay. (7:38 p.m). Panadol Osteo 665 and clonazepam 2 milligrams. Good girl. I know that's really, really difficult, and this is what's really, really stupid. We should have so many other sort of options that are injectables or liquids that we don't have to try and go through swallowing in dysphagia. We don't want fluid going down into the lung during that phase. You did really, really well. It's okay. You're going to come around soon. It's going to feel a bit yuck. You've already had the intense headache after seizures, so you've had a few different sets of tonic-clonic seizures. And you've had a lot of dystonia. You've had some focalized dystonia on this side, but it feels like it's released off on your right hand. Oxygen stats 97, heart rate 52. My knees aren't working anymore. Oh. Yeah. Just going to take a blood pressure and see where you're at. I'm going to take you down a little bit now. Just relax back. You're not fully out of the woods yet. Okay, I'm going to keep that in there for the moment. Heart rate drop. Current time is 7:40 p.m. It's 23 degrees outside. It is 23.8 degrees inside. Heart alarm is at 49 beats per minute. Oxygen sats are okay at 97% at the moment. Hey Max. Feel a bit of a squeeze in your arms, just take your blood pressure. Secondary reading, it's actually gone a little bit higher, so 106/71. Now, for most people, they want to be in that 120/80. We don't, because that's not Dyan's normal baseline. 56 for the heart. Pain, left hand side, tails back. I'm going to give you some medicinal CBD. Oxygen sats are at 95, heart rate's at 51. Okay, sweet pea. What's in your mouth? Medicinal CBD THC combination 1010, 0.5 of a mil provided, 742. That'll help with some of the nausea, muscle relaxant, it'll help with the pain. Dyan's doctor has also advised to increase the THC level, which will be the component that actually helps with the pain relief, but unfortunately we have actually adverse reactions when we increase too much THC, so everything is at Goldilocks, just right. Not too much, not too little, just in the middle, just right. Heart rate's at 49. Max, can you leave Mummy's cord alone for her mobile, please? Thank you. Good boy. Max is here with your baby. He's floating around as well. He's keeping an eye on you, okay? He's just here by my feet. Yeah, I know. You just need to relax at the moment. I can't get him for the moment. He's under the bed. Oxygen stats remain solid at 97%. Heart rate is at 54. So as I was saying, the recommendation from the doctor recently to help manage the pain, apart from the liquid tramadol, while we're waiting for the pain clinic at hospital to look at ketamine and other solutions, he's tried to increase the CBD THC component. There are different combinations that you get. 10-10 is an equal ratio. You can get 20-5, 10-1, variations like that. Through all of these conversations, please remember that these are specific to Dyan's journey with her condition. These are not advice, guidance, recommendations for you at home, nor are we here to prescribe, nor are we here to diagnose. That's what your doctor, general physician, primary care physician or specialist are for. So if you do have concerns for your own health, please do go see your own healthcare professional. Maximus! Where are you, Maxie? Mummy wants you. Dyan's coming around more cold, is it? Able to talk. Both eyes aren't fully able to open at this stage properly, but it's great that she's able to talk. Oxygen stats are great at 97, heart rate's at 51, not so great. Maxie Moo, I've got you, I've got you. Come here, Mummy wants you, buddy. Now, no biting of Mummy. Be gentle with her, please. Be gentle with Mummy. Yes, you can have a gentle, he's a little bit, wants to run around, so he might not be able to stay still for you. Current time is 7:45 p.m. and it is Sunday the 6th of April. Oh, lick lick. Cats help us relax, don't they? Except when they bite. They help keep us calmer, which is nice. But he is a bit of a toddler at the moment and he's still going through that whole biting phase. So we're out of the tonic clonics. We've still got some post-seizure activity with some ticks, and I'm waiting to see if the dystonia. Yeah, we get you. Generalised dystonia with the legs is quite common with this thrashing action that can occur. Part of it's also called chori. Comes after the Greek word choreography, because it's meant to look like dancing actions. Well, at the moment she looks like she's doing a Irish dance. You're not helping doing Mummy's Irish dance, Max. You can hop down in case you bite her, please. But that rhythmical movement, again, is part of the movement disorder. It's part of the dystonia, so it's part of generalised dystonia. And they're uncontrollable. Okay. Being tired post-seizure is very, very common, and falling asleep or the yawns. And yawns are what we commonly look for because they're more of the muscle relaxants. You're cold. And I'll bring this tuner up so we have more control over it. There we go. Where did you go? Go. Oxygen stats remain solid at 97%. Very happy with that pulse dosage. That's helping keep that nice and even and level. Heart rate's at 55, and look, a bit of the rhythmic movement will have increased her heart rate. They like doing exercise and activity. Ticks post activity, what we also expect to see, but I'm going to bring the temperature down to make sure that that's not hitting a level. So 24 on that. Current room temperature is 22.9, it's a little bit too cold for dance, so let's bring that up and warm it up a bit for her. It's a balancing act, like I said, Goldilocks, we need to get everything right. Sweetie? Hiya. How's my girl? Max? Max the cat, Mad Max?
Okay.
You're okay. I think you're coming around. The seizures are definitely stopped. You're going to have a bit of a ticking action. I've just brought the temperature, like that. The ticks will subside. You've had some clonazepam to relax your muscles, some additional CBD. You'll be a little bit tired. If you want to roll over and fall asleep, that's perfectly fine too.
No.
Okay. No problem at all. Do you have any pain anywhere in your body that you need to tell me about? Okay, so mid lower back, so coming around the mid-thoracic right-hand side. With that, is that tightening? Is it thrusting? What is it feeling like it's doing? Can you explain? Because there's different types of pain, so we need to try and get an understanding and explanation of what it is. Your cloth is here. The spasming. Aching spasm, okay. And I'm suggesting that because with the dystonia that I'm seeing, it's quite common for Dyan to have dystonia also in the back muscles, either upper or lower. So that's part of what I expect. Your head, you had clutched twice during the activities after seizures, with pain shown on this side here. Do you have any pain in your headache at the moment? Yawn, 7:49 p.m. First of the yawns that Dyan's actually shown me. Thank you. Ticking action, also neurological for Dyan, part of the Tourette's, but also post-seizure activity is very common. Did you know that Willow's card you knocked off during your seizures and it fell down on top of you.
Oh.
I put it back up atop on the ledge above you. So I think Willow was looking over you trying to say, hey, you'll be okay. Oh, she was trying to slap you around with a card and say, wake up. I don't know which one it was. You'll be okay. The pain will go away. Medications I've given you will help relax you. You just got to keep an eye on your heart rate now, okay?
Chest pain.
You got chest pain now. How bad is it? Mild. Okay. If it changes, you're going to let me know and we'll use some spray, okay? Again, with the dystonia in the back, I can expect you to maybe have some pain around the pectorals and causing that feeling of tightness, alright? So you just relax, it's all normal. Did you bite inside your mouth, tongue or cheek? Can I have a quick look inside? Nothing you feel? Just gonna have a quick look just to make sure that everything's happy campers, yeah? A bit of a post ulcer on the right hand side. Your jaw's going to be side because of all the dystonia. Yeah, I'm so sorry, it's really, that's to be expected.
Oh.
You were doing a lot of left jaw thrusting with your mandible, and that means the TMJ and the jaw is probably out. Do you remember how to do the gentle exercises? So slowly,
Oh.
slowly. It's better to go slow. Try and open straight down first as big as you can. Good, you go click. Does that feel a bit more relaxed in now? Is it overbite or underbite with your teeth? You're overbiting at the moment. Okay, so try a nice deep drop of your jaw and then a jaw thrust. Thrusting your jaw forward. Think of poking your chin out for me. Does that make sense? That's the girl. Drop your jaw down wide. Wriggle side to side. And relax it and see how it feels now. Take it slowly. If you do it hard, you're going to engage the muscles and the bone. How's that feeling? Post-seizure pain is quite common and we have to work our way through this. Don't know, can I have a quick look? Yeah, you're very engaged just up above. Okay, you've got a lot of time. So the muscle relaxants, I'm going to ease that off. I'm not going to try and actually pop your jaw in or anything. We're going to allow the muscle relaxants. The easiest thing for you to do is think of like a really relaxed jaw, just as if you're like, oh, your jaw just needs to fall down. Now I just want you to relax those muscles like this. And you're not to engage it, not to try and do anything, just think relaxed in that position, okay? And we'll see if we can disengage some of those muscles and the tendons and the ligaments that are supporting the joints, and hopefully that'll relax a bit. As I move down, I'm keeping an eye on your chest pain. How is your knees, hips, ankles? Has there been any problem with those during this exercise?
I can't feel my body.
You can't feel your body? Can you do me a favour? Can you wriggle your toes for me? Great. Now the check of doing that's quite simple, both neurological and physiological. Second yawn, 7:53. We're definitely out of the seizures once we get to those good deep things. Unfortunately, the yawns will engage the transmandibular joints. You can take. You got a bit of a headache in there?
No, when I yawn.
When you on those muscles, I know. I really do get it. You can take your oxygen off now if you like. Yep, absolutely. Okay, and we'll just keep an eye on your levels over here. That was very helpful.
Up my nose.
It was up your nose, right? How weird is that? But you did very well with it, considering the sensory related issues of having something like that. You don't, because you're mostly out. Your head out and syncope and seizures. Cognitively, you're not really aware of the time that you've been going for. Heart rate has improved and increased up to 60, so I'm really happy at the levels of that. Oxygen is still remaining nice and high after taking the nasal cannula out at 97%, so I'm very happy with that.
Maxie.
Well, there's Max. Diane's obviously able to communicate. She's been able to relay where pain is and also where the cats are, so I feel that we're out of the cluster. Maybe. The yawns have indicated that things are over. You might have some post-seizure tics, but that's okay. We'll keep an eye on you during those levels. Just using an alcohol wipe to clean that up. I'm going to power that off.
Ow.
That jaw joint is really, really sore, isn't it?
Jimmy on.
And here comes the Tourette's. So not just the physical, motor-related action, but you're going to get sometimes the vocalized action, maybe a bit of cop-related will come in. This is quite common. Sometimes we'll see it before seizures, or sometimes we'll see it after seizures. Again, it's all neurological. All part of this 22q. You've got all of these things that have been challenged and worked with simultaneously.
Really?
Heart rate remains consistent at 62. Really happy with that. Willow's doing really well over there, isn't he?
Yes.
Yep, our big boy, our big rag doll.
Jimmy.
He is. He's keeping
I
a
love
close eye
you
on you.
too, Willow. I got you back.
So we haven't had to apply midazolam to break out of the seizures because there was multiple sets. They were small, they weren't vigorous, so that was great for the tonic-clonic. Diane's just trying to release some of the pain and the muscle and ligament tendon pain that goes around that whole jaw and ears. Well, not what we want for a Sunday afternoon, but unfortunately quite predictable, really. Hey Willow, what do you reckon, buddy? Thank you very much for helping me. And thank you guys at home for being around and keeping on top of Dyan as well. Third yawn, that's the third I'm looking for, 7:55 p.m. So we've been doing this for an hour since the very sudden onset. It is now almost evening, so we're going to get into some of the night medications and keeping an eye on her. The Tourette's may continue for another hour or 2 hours. Okay, so we hope to see them subdue and relax as far as symptoms go. Diane's going to be very tired, but fighting between the ADHD side of things, it's not mean that she's going to fall asleep. She's just going to be feeling more fatigued. It's exhausting. It's very physically exhausting going through something like that for her. A lot of pain to have to deal with. Obviously, some of the pain-killing medication will also make her a bit more tired. And the downside of having some pain relief may also cause additional constipation that has knock-on effects to other symptoms like gastroparesis thereafter. So, not very good. All good. Guys, thank you so much for being around, as always, with us on the channel. Big thumbs up of encouragement for Dyan. She's got through yet another episode. I'll now need to log that for the clinical team, write down the information that gets passed on, part of the seizure logs. That's part of the routine that we have. Keep an eye on her for safety. We'll have a monitor on her during the night to make sure that there's no heart rate drops, because some of these medications will also contribute to heart rate drops. We'll expect to see into the evening.
Nice.
We'll download the data. So the data coming off the pulse oximeter will go onto the laptop, and we'll get information and readings of her oxygen and heart rate levels and movement during that period of time as well. Thank you very much for watching. You have comments, questions, ideas and suggestions, leave them below. If you're new to the channel, welcome. Don't forget to subscribe. Please share our channel so others in the community who might be dealing with rare, complex, chronic illnesses can find us and help be a part of the awareness and education that we're trying to do for 22q. That's a chromosomal disorder, genetic disorder that Dyan has got, missing a microdeletion on the long arm on the 22nd chromosome, 30 to 40 genes, 3 million DNA building blocks, and affecting, unfortunately, her whole body, cellular level. 180 different clinical symptoms can be seen in these conditions, and she has a lot of it. Yes, and I feel like I'm going to be doing a bit of traction, so now I'm going to put my other hands on. I'm going into the chirophysio mode now. I'm going to have to be doing some traction, lengthening her neck and trying to get rid of some of the dislocation around here and the tension around here. No, that's right. That's right. Dyan actually got some foam planes to make from the Aviation Museum, the RAF Aviation Museum in Bull Creek today. So we'll leave it for another day, but I will spend a bit of time working on your neck and your head to help reduce that. All right, guys, love you and leave you. We'll see you in another episode real soon. Bye for now.